Morning. I'm Dr. Ben Newman, and yeah, it's coronavirus time. This is what I do. So here we go. Today's first and I think only question is actually a follow up because I didn't do a very good job answering the last one. So, Tanya, take it away. Tanya's question is thanks for the answer, but what I meant by the original question was, and so the question was basically kind of indirectly about the president's, like, are the treatments that he was given responsible for him getting out of the hospital early? And so there's plenty more there to talk about. So let's go into this. Yeah, let's see. The question is whether early intervention could help stop the disease from progressing to the severe stage. And maybe the point of no return, like needing a ventilator. Yeah, which is fairly accurate. Yeah. It's the numbers are better than they were at the beginning in terms of people coming on ventilators, not all dying, but yeah, if you get to that stage, it is very bad because the immune system's tearing you up from the inside, and your lungs are not working very well, and it's just an assault on the whole body. Nothing good there. So I've looked at the papers on the Regeneron monoclonal antibody treatment, which mostly they don't publish stuff on that. They're keeping it all under their hat, and there's a lot under their hat from what I can tell. But from the little crumbs that they have sprinkled out, between that and dexamethasone and the other treatment he's on, remdesivir, I don't think there is a strong indication that any of these things actually prevent the severe outcomes, even when you start them fairly early. Part of this has to do with the treatment protocols. So you would have to set up a test saying you're just going to give this potentially powerful drug to people who have mild COVID and do it with enough, a couple hundred people in the group that get it or the group that don't, and you may be able to tell the difference there. Some of the earlier tests tended to reserve these more sort of extreme interventions and basically unproven interventions for people that were already in bad shape. If you look at the remdesivir paper, for example, the latest is the first part of the phase 3. They've got a couple other arms of the phase 3 going at the same time. What it shows in the headlines are that they managed to prevent a few deaths. There were something like 2 or 3 deaths in the untreated group, and it goes down to 1 death in the high treatment and no deaths in the low treatment. But dig a little further into the paper and you find out there were several people in both of those other treatment groups that did die and were getting some remdesivir. It's just that because of the way the study was structured, they actually pulled those people out of the study for their own care. It looks as though they're getting worse. They're on this treatment. Clearly, this treatment's not making things better. And so they pull them out, which means that statistically, you can't really count them among the people that finished the course of treatment. And so, yeah, they end up missing from some of the statistics, although they had very bad reactions. You put those back in and you end up with about the same number of people dying and about the same number of people in sort of severe shape with the drug and without the drug. What it did do and what the papers do show is that it tends to get people out of hospital a little faster, but maybe not as many of the severe patients, but yeah, the regular patients. That's because that's where most of the infection is anyway. So, yeah, this is the holy grail. We want something that you can give to people that just makes sure that they do not die while their bodies are fighting against this virus, and just buys time for them. Get some time for their adaptive immune system to kick on and start to win the fight. We haven't got one of those yet. It would be nice to have one. A lot of people are looking for one. The ultimate, I guess, is to just knock out the virus completely and or shut down the part of the immune response that's hurting you and not productively stopping the virus. So yeah, a number of ways that we could treat this. We just don't have any drugs that actually definitely, hand on heart, work that way yet. Yeah. And so then there's a follow-up question a little bit further down. Let's see. So there's no early interventions. Yeah. And people have thought that a number of these drugs might be useful for early interventions. Those trials tend to start after the trials for more critical interventions, because you can finish up a critical trial. The person is in bad shape. They usually either die or come out of the hospital relatively soon after that. And if you just start a full course, it can go on for a month if somebody has mild case that then progresses into a worse case. And so, yeah, that's kind of the way, at least I understand it from the things that I've read. Yeah. But there's more information out there. I've got to go look at some more papers, and I don't know, maybe something new will come out and it'll change my mind. We will see. Yeah. Last little part of the question, does this actually mean that he clearly had a very mild case that would have remained mild without all the treatments? That's a thing we're never going to be able to answer. In the lab, you can get 20 mice that are genetically identical, do the same thing to all of them, and establish a rough percentage. What are the chances that if I did this again, the particular outcome would happen? But, yeah, with human clinical stuff in a hospital, you got an N of 1 for each one of these, and you can lump them together in studies to try and figure out what's going on, but it's not really as clean an experiment. So no, we'll never know. Still, I don't know that we will ever know how severe it was. Maybe eventually some of these non-disclosure agreements that apparently the doctors have had to sign will lapse, and some information will come out that way, or somebody will anonymously leak it, at great personal risk. I don't know that it really changes anything. Clearly, if he was in hospital and positive with the virus, you should not go straight from there back out into the world meeting people without a mask. That's, absolutely bonkers. Well, it's just a guaranteed way to spread the virus. And haven't we had enough of that at this point? I mean, really, yeah. I don't know. Sometimes you expect people to know better, and sometimes, sometimes you're pleasantly surprised, sometimes not so much, but there you go. Great questions. The second one, totally unanswerable, from a couple perspectives. But that's the idea. No, it would be nice to have a drug that definitely does that, and maybe someday we will. Till then, thanks very much. This has been Ask Dr. Ben.